lot of time when I'm talking to patients who are suffering with hiatal hernia syndrome, I tell them that, not only at the end of this program, if all goes well, because we have an 85% success rate, so not only at the end of the program will their heart palpitations and their panic attacks and shortness of breath and digestive problems be resolved, but that we are setting the stage for them to not be the statistic that is modern America at this point, because the health stats in the US are terrible, and I'm not sure if you know how devastating they are. Of all developed countries, we live the least long, and yet we spend twice as much on our health care. And and I've written down some stats. I'm going to look down at my notes a little bit, but 52% of adult Americans have type 2 diabetes. 30% of American teens, 30%, a third, have pre-diabetes. 75% of Americans are overweight or obese. Autoimmune disease is increasing by 12% per year. This is tragic. 77% of our young adults cannot serve in the military, either because they're obese or because they have need of a certain medication that disallows that. Half of all adults, 1 out of 2 adults in our country will get cancer at some point in their lifetime. Young adults' cancer rate has increased 79%. These skyrocketing statistics really put us in a health emergency that is not being talked about, and most people don't really know exists. And what's happening is we're being destroyed by chronic illness, which at its root, what's the root cause? Diet, lifestyle, environmental toxins, and overuse of medication. And our program, whether it's hiatal hernia syndrome or something else, addresses exactly those things. We here at Root Cause call those foundational lifestyle basics. So, diet, lifestyle, environmental toxins, overuse of medication. The overuse of medication is handled naturally as the patient improves. So we're able to diminish their use of meds as we've restored function to their body. And that's part and parcel of our program, as I said, regardless of what your problem is. But with hiatal hernia syndrome, at its foundation is diet, lifestyle, toxins. This is how all the inflammation has occurred that's resulted in the majority of the symptoms associated with hiatal hernia syndrome. So one of the things, again, that I just love about our program is that it's all embracive. We're not siloing you into, oh, you have acid reflux, try apple cider vinegar instead of a PPI. Not at all. We're standing back, we're looking at your body as a whole and saying, how did we get here? What is the root cause? And how do we optimize function of your body? So if you're somebody who's been suffering, really consider reaching out, giving us a call for a consultation. We'll figure out what kind of program. We have a lot of different programs. What's the best fit for you? And we'd love to help. That's why we're here.